Good afternoon, or good morning. It's still morning time. It feels like it's afternoon. Today we join you from the Unified Command is on site in the community of Welborn in Calhoun County, conducting a test site for COVID-19 today. We've had an overwhelming response so far, with literally hundreds of people lined up just behind us here to be tested in this community. We've seen this very same thing over the last week. We were in Weaver through the Unified Command and the Alabama Department of Public Health over the last week on Wednesday, with over 200 people tested and people having to be turned away because there was a shortage of test kits on that day. Today we have a lot of test kits and we're prepared to test hundreds of people, and they have showed up. We believe that with the number of people that are here, as well as hearing from our experts on the Unified Command, it's a very important thing for us to continue, which we plan to do. The numbers indicate that, and that's what we're here to do, is to give you an update on where we stand in Calhoun County with COVID. So when you look at the numbers, over the last 7 days, we've had 436 cases. This is a very, very large increase in a very short amount of time. If you think back over only about 6 or 8 weeks ago, we only had 6 new cases in a week's time. And so the disparity between those two show that we definitely have a surge in this community throughout Calhoun County. And while we have taken time over the last months to be prepared, to train people, to educate the public, it's game time now. This disease is very present in our community. Some people still debate the effects that it will have, and we won't know that for maybe weeks or a month to come, but we're seeing some pretty severe effects right now through the hospital and through other impacts it has on our capacity, as well as our first responders' health and safety in the community. So at this time, I'm going to turn it over to Lewis Bass, the CEO at RMC Hospital, to give us an update from the hospital's perspective. Lewis?
As Michael said, I'm Lewis Bass, the CEO of Regional Medical Center Health System, and COVID is real, and it's really started hitting us at the end of last week. At our peak, we only had, in the initial surge, we only had 8 positive patients in the hospital at one time. Most of our patients were patients under investigation, but currently, as of this moment, we have 16 positives on our COVID unit. We have an additional at least 3 patients that are currently in our emergency room that we feel very confident, or they've been tested, and that we feel very confident they will require admission. That would give us 19. Of those, 3 of them are on vents on our unit. We have multiple units on our hospital that are available for COVID. We have opened our first unit. It's a 22-bed unit. It is open. We are in the process right now of preparing and relocating patients to open up our second unit. So it's very real. I implore the people of Calhoun County, please wear masks and observe the things. Wear masks, separate, and sanitize. Those are the 3 things that we know we can do to help make a difference in handling this disease.
Good morning. I'm Dr. Free. I'm Chief of Staff at RMC and also a hospitalist. We have seen a great surge in the positive patients coming in through with COVID. We have a lot of change with our patients. Initially, we saw a lot of the older patients succumbing to this disease. Now we're seeing younger people. We have 3 people on vents that range the age from 44 to 70, 2 females and 1 male. They are sick. They're on, one particular person is on pressors, which keeps the blood pressure elevated. We also have patients on insulin drips because of DKA and comorbid conditions. We can't stress enough that you've got to wear masks. You must wash your hands, social distance. We're noticing also, a couple of days ago, I admitted a younger person, 24, who had been to a party, had been to 3 restaurants in this area, not wearing a mask, partying around, playing, and this is not something to play with. We've got to be serious about this. We're surging, and we've got to get this information out to the public. It's mandatory that people pay attention. For medical use, we are capable of controlling what we have. Now, with the comorbid conditions, it's very, very important that you come to the ER very quickly if you're very ill. If you if you're tested and you're positive, and it can be taken care of at home with just the complaint of fever, chills, malaise, which is weakness, nausea, vomiting, diarrhea, those things can be taken care of at home. If you become short of breath, come to the emergency room for sure. If your chest x-ray reveals that you've got pneumonia with infiltrates in areas, or your oxygen saturation is greater than 95%, we will consider you a moderate to severe person. We will admit you, we will treat you, we will treat for community-acquired pneumonia and the treatment for COVID. If your oxygen saturations drop, if you have respiratory distress, if your respiratory rate increases, if you have decrease in blood pressure, we will consider you a severe person and try to get you into an ICU. It is mandatory that you pay attention. Please, please wear a mask, wash your hands, and self-distance. Thank you.
Hello, I'm Nanette Moodium. I'm with St. Michael's Clinic. I'm the director of a clinic that serves the poor and uninsured of Calhoun County. We see primary care services for the most vulnerable patients, and we are definitely seeing the surge that we've really been preparing for the last couple of months. So I want to talk to you about getting tested today. The first thing I would say to you is, if you feel like you need to be tested, you know you've been exposed or you're experiencing symptoms, an opportunity like this today to come out and get a free testing is perfect. We want you to utilize these opportunities. We know that they're going to continue to come as community agencies work together to get a free testing pretty much each week. But if you need some more information on being tested, RMC does have a testing line. That number is 256-235-5600. They will write out a referral for you. You do not need to be a physician to call this number. However, I would say if you're going to call this number, you need to be somebody who's had a known exposure or you have symptoms. Some other testing opportunities are the Alabama Department of Public Health is also testing people on Tuesdays and Thursdays. You need to call and make an appointment for that. And then locally, we have a fairly large primary care practice here, Southern Immediate Care. They also do testing, but that is for a fee. So you would also need to call and make arrangements with them. So getting tested is very important. If you are symptomatic and you have not met that threshold that Dr. Freed talked about in needing to seek emergency services, meaning you're not experiencing severe shortness of breath, you may be feeling ill and certainly uncomfortable, but we know that most of you are going to stay at home. So if you're staying at home and you have a positive patient in your house and you're living with them, you need to even distance within your home. Designate a sick room in your house. Don't share toiletries, bathroom items. If you can avoid sharing a bathroom with the sick patient, you need to. We want to not share kitchen utensils. Any of those kind of things, we're going to wash our hands frequently. You've got to do the best you can in order to not get sick. But we're going to need all that household to really lock down and quarantine. So if you need assistance with that, if you're in quarantine and you don't have enough groceries, St. Michael's has a COVID care program. I will give you that number. That is 256-240-5505. You can call us Monday through Friday and enroll in that, and somebody will call you. We'll help work with community agencies who can assist you with practical needs that you might have. We also have clinicians on staff who can give you some advice about symptoms that you may be experiencing or that a family member is experiencing. It's just really important right now to come together and do those things that we've been talking about for months, and now the surge is here. So let's work together as a community and keep each other safe. So if you're sick or a family member is sick, it's time to stay home and let people help you. Let your neighbor help you. Okay, thanks.
Keith Cadle, Fire Chief of Jacksonville. I'd just like to remind everyone in Jacksonville, in and around Jacksonville, that we're still under a safer at home order. If you would, please wear a mask when you're out in public. To remember to wash your hands often, use hand sterilizer. If you do make a 911 call, please advise the operators or responding crews if you're positive for COVID or if you have COVID-like symptoms. This helps our crews better protect themselves. There's a limited number of first responders in Calhoun County, So we need to be vigilant and to make sure that all of our first responders are protected and that they stay free of COVID.
I'm Ben Stewart, Assistant Fire Chief, City of Oxford. Going back to what Chief Cadle just said, that's the normal protocol throughout the county for all first responders. As a responder, I want you to know this is real. It's here now. We rely heavily on RMC. We rely heavily on our medical staff to treat us. One thing that I ask you is when this started, we started out in Calhoun County, we had a good handle on this by doing the right things. A lot of times this comes down to respect of each other, respect for myself. Practice your social distancing. Wash your hands. Wear a mask if you have to. But be mindful and respectful of others. Just because you may not have it now does not mean in the future. It's real. We're seeing it hit a younger age group now. Just remember, I'll reiterate, being on the county task force, this is our workers. These are the people that work in our workforce. So just be mindful, considerate, and please help us stop the spread.
Thank each of you for coming and giving your expert opinions today. So from the Unified Command, when we consider all things throughout the county, we see some trends developing. So a few weeks ago, we announced that the data showed that the majority of people who were contracting COVID in Calhoun County was the age group of 25 to 49 years old. That still holds true, however, only by a very narrow margin. The new age group now is younger children and teenagers that are contracting COVID. That's the second most growing age group of people in Calhoun County right now contracting the disease. You may say, well, it makes sense. Kids are active, the younger adults are active, and they're out moving about. But our older and more vulnerable populations depend on that age group to take care of them, to assist them with things, especially during a pandemic. So it's important for us that may be in that age group to take these precautions, to take it serious, just as Assistant Chief Stewart said, to take care of our neighbors, to take care of each other, and to have that respect for one another. And so from the Unified Command, we encourage those precautions, whether that's the wearing of masks, keeping distance. As Chief Cadle said, it's safer at home. That's what the order says, and that's what our state health officials recommend. So take the precautions seriously. This is a disaster that each of us have the ability to do our part to prevent. Not all disasters are that way, but this one is. So each of us can do our part to protect ourselves, to protect others from the dangers and the risk of COVID. The Unified Command continues to work and will continue to work through a number of ways. In our meeting this morning, we identified a couple of more long-term strategies, nothing really different than what we've already been doing, but we've reaffirmed those. Of course, it's our first responder health and safety. We have to take care of those who take care of us. And so today behind me, there are dozens of first responders and nurses that are working this testing site. But that's only a small portion of those that are actually in the hospital today taking care of those patients that are admitted at the hospital, or those first responders, those firefighters and law enforcement officers and EMTs who are responding to calls for service at our house. For those other essential workers that take care of our government services and all those things, from the Unified Command's perspective, we've got their back, and we're going to continue to do things to make sure that we're monitoring what's happening among those groups and that we can provide hopefully as many resources as possible to support them. Another area that we stay concerned about and that we make sure that we're on top of is capacity for care in our medical facilities, as well as readiness for response in the field. So we're continuing to monitor those numbers and the resources that may be needed there. Our supply of personal protective equipment, the masks, the gloves, the gowns that our first responders have to wear when they're interfacing with those patients, our Unified Command continues to be very active in trying to procure and direct those organizations on where they can procure those important resources. So those are some ways that we continue to work and will continue to be active. Direct impact in the communities, we're going to be looking at those communities that have that direct impact and those hot spots. As much data as we can get from the State Department of Public Health, we're going to put that data to work actually on the ground. Just like today, we're in Welborn, and we're here because the numbers started showing that we were developing a hot spot in this community among young people. And so RMC and the Unified Command responded with a testing site to be able to provide easy access and free access to folks to get tested so they can be informed and make those important decisions to help to isolate and not spread that throughout the rest of the community. We're going to continue to look at that data and continue to try to respond with actionable steps such as testing sites to be able to reinforce that and support our local communities. And the second thing, and I'll leave with this, is the precautions that we've stressed. Each of us have talked about the important precautions of mask wearing, of social distancing. I think there was a doctor, maybe that's at Huntsville Hospital earlier this week, that I saw in a press conference. And they were asked the question, what do you think about a vaccine? When is a vaccine coming? And the physician very wisely said, the only vaccine we have right now that we can see in the foreseeable future is the mask and the social distancing. That is our vaccine. And it's important for each of us to use that vaccine to its fullest. It's all we've got, and so it's what we've got to use. So at this time, we'll take questions from our Facebook live audience as well as from the media that's present today.
Michael, it may be for the administrator or the doctor, but there were some recent comments from Senator Dale Marsh, whose constituency is this area. What are y'all's reaction to those people where he's not worried about the rise in numbers of cases?
So the question is, Senator Dale Marsh had some comment in regard to not being concerned about the rise in the number of cases. I think we have to address that from a medical perspective. I'm going to ask Dr. Free and Mr. Bass if they'll address that from what the science is telling us, from what we're seeing in the hospitals, and what we need to be concerned about in the community.
The rising number of cases indicates we are testing more. Some of these people may be asymptomatic, which is a concern, because the asymptomatic carriers will take this virus back to their homes. If they have immunosuppressed, comorbid people in the home that have diabetes, high blood pressure, they're on chemo for cancer, they have children, the whole 9 yards, they're going to infect that family member. So we've got to be diligent. When we see this surge here in this area, what we're finding is if you wear your mask, if you wash your hands, if you stay away from people like we did in the very beginning, we would have a better outcome. People are just releasing they're allowing their inhibitions to occur, and they're not paying attention. You've got to pay attention. You've got to stay away. You've got to stay vigilant and safe. So I understand the government wants things to get back to a normal type of way. We have to do it in a smart way. We have to do it in a medically, economically sufficient way in order for this virus not to overcome any further. We've got to wear masks, got to keep your hands clean, got to stay away from people, got to be smart. That's all I can say.
Is there something to be said for herd immunity?
I'm sorry?
Is there something to be said for herd immunity?
In the past with other viruses, of course, herd immunity was very important. With certain diseases like smallpox, it definitely helped. This is a new virus, a novel type of disease. We don't know what it's going to do. If you have the idea that you keep your mask off and stay around people, go to COVID parties, get sick, I don't think that's a wise thing to do. We don't know what this disease can do. We are seeing what it is doing. We just don't know what the implications are in the future. Is there some type of immunity? We don't know. The convalescent plasma that people are donating once they've had the disease, we don't know if this is really working yet. There are research studies that are going into this. So it's wise to be smart, and herd immunity for this disease is not at the forefront yet. Thanks.
Senator Marsh's comments appear to suggest that once somebody recovers from COVID-19, they can't catch it anymore. Has science indicated that that's the case, or do we even know that?
We don't even know that. Science is, we're not even at that point yet. It would be lovely. In the past, we've seen that the SARS-CoV-2 with the swine flu and other diseases, the Mediterranean SARS COVID disease, it came and it went. Hopefully this is what this will do. What we're seeing though is a surge, and it's, it started in China. They still had problems. They're still having problems. Not as much as we are, so we don't know. And to be on the safe side, it's best to just, stay safe and do the right thing.
got one last question, for either one of them. It's just about hospital capacity. Where are we at hospital capacity at this point?
Right now, we're okay. We are fine right now. We have, like I said, we have 2 units that will house 42 patients. We currently have 16, potentially 19, depending on those 3. But we're in pretty good shape right now throughout the hospital. The long-term effect is the potential shortage of staff. We're really only limited by staff, so keeping our staff and our physicians healthy going forward is going to be important. But right this minute, we're okay.
All right, other questions?
This is from Facebook, and they're asking, are masks mandatory in Calhoun County?
So at this time, there's no order that makes masks mandatory in Calhoun County. It is a recommendation from this unified command that's represented here after discussion about it, consultation of our subject matter experts, that it is better to wear a mask than not. And so we do heavily recommend and suggest mask wearing anytime you're out in public.
And why is it not mandatory?
So it's a complicated issue when you look at enforcement of that and each of the municipalities having to invoke that. So the state health department would have to do it to make it totally countywide, independent of each municipality taking action on it. Our cities throughout the county are looking into the issue. There's one municipality that discussed it this past week and passed a recommendation while they continue to consider what an ordinance may look like. I understand from talking with city officials that other ones are gathering information as well on how that issue may be considered in the weeks to come at city council meetings. So I think it's something that definitely the discussion is going on among our leaders. They are consulting the subject matter experts, and I believe they'll make the right decision.
And is it safe for our kids in the county to still be playing ball at local parks and ballparks and such like that?
So the question is it safe for our kids in the county to still be playing at parks and those kinds of things? I think we have to learn the lessons from the medical experts, and we have to put these precautions into play. We can't just completely stop life, but there are many things we can do to contribute to our health and safety. And so just as Dr. Free, the Chief of Staff, a few minutes ago talked to us about, wearing masks when we're out, hand sanitation, keeping that distance, and we can still have a semi-normal life with just putting a few common sense precautions in place.
Do you see schools starting as normal in the fall?
So the question is, do you see schools starting as normal in the fall? This unified command is very involved with the local school systems in Calhoun County. Just yesterday, we had a meeting, and we have regular meetings with the school superintendents. Right now, they are moving forward, the school systems are, and many of them have released plans for a safe reopening. Our subject matter experts are assisting them with some of that. And so I think time will tell. I think we've got, about a month before that absolute decision has to be made. Preparations are moving forward for that. Again, we can't just completely stop life, but we have to figure out how to modify our lives to stay as safe as possible and yet accomplish our goals, such as one can't be any more important than keeping our kids safe, but also educating them. So I think our educators and our medical experts are doing the very best they can to figure out how to do that and to do that in a safe way. Ben.
A few people have mentioned now that this is skewing toward younger people, minors under 18. Is there anything that we know of that might explain that? Are we testing them more as they start going back to school programs, or is this something that's new as opposed to something we just didn't see?
So as far as I'm aware, and Dr. Free, I'll let you speak to this. Also, the question was, we're seeing more young people, right, that seem to be positive. Is this new, or is this something we just haven't seen before? Based on what I'm aware of the data, this is a fairly new trend and probably attributed to sports are back in. There's some practices going on. People have been, we do know of some parties that have occurred where, young people have gathered and those kinds of things. And so likely that has been spread through that. From what the hospital's seeing, you may want to speak to that as well.
Just as Michael was saying, people are getting out more. Before, when we had mandates that had people staying at home, of course, family members would get sick. But we're seeing, how young people are. They want to get out. They want to do things. They've been cooped up for months. And if we could have if they would just wear masks, it would have been a lot easier if they keep their hands clean. We saw where all of these people were out at the beaches, in the water, close to each other, and you would think, okay, out in the environment, maybe the virus wasn't so prudent, but we're finding that this virus is very virulent. So everything is in the up in the air, so we don't really know. What we found with older people in the beginning, the comorbidities were what was making people sick. Now kids are out, young people are out, they're touching each other, they're having fun, and they're spreading the virus that way.
Michael, I have a question for you.
All right, I'd like to follow up on the kids' question. I have children myself. We've taught them about the virus. We've discussed what it is. Obviously, it's a big part of what I'm doing professionally right now. Our children, when we're out, we haven't just completely stopped, but we're limited. We're safer at home. We've limited some of the things that we do, but we do wear masks. We have masks. My wife made masks for our children, and so they're cute wearing it, but they do. They've just learned that that's what we have to do right now. And so I would encourage others as a parent to teach those things, to model those things, and to modify behaviors accordingly. We can still go and do to some extent, but just make those modifications, make those adjustments. Let's be a good example in the community for those folks that are younger than us, because again, our older, more vulnerable population depend on us, and so we have to be prepared to be able to take care of them.
You said something about parties. Are we talking parties with the express action to get COVID like they were talking about a couple of weeks ago, or is this just kids getting together?
So the question is, are the parties I mentioned a minute ago, are they COVID-specific parties, or are they just gatherings? Of course, in the media, I've been aware of some COVID parties, but none that I'm aware of in this county that this Unified Command has been aware of. The parties that we're aware of, that we have seen through the contact tracing that our medical experts are doing, have been gatherings, pool parties, those kinds of things that are natural things to do in the summertime, but maybe precautions weren't followed, and somebody was positive there and it spread. So I'm just talking about the normal everyday gatherings. We have to limit those. We have to respect each other when we are at some of those and make sure that we practice the precautions to the fullest. What other questions? All right, very good. That's all of our questions for today. Thank you for taking time to join us live. We thank the media for attending today. We would remind and encourage everybody to continue to stay updated for the latest information in Calhoun County. That can be found at calhounema.org, as well on our Facebook, Instagram, and Twitter accounts. And if you need anything, we can always be of assistance by telephone at 256-435-0540. Thank you, stay safe, and have a good day.